Hey everyone, today I'm going to be taking you through an extremely high yield memory palace that will cover all the new drug updates for your upcoming INI-CET exam. This is going to be extremely high yield, so please watch till the end. One scene will cover all the drugs. So let's get started. Let's step into this crazy restaurant. So scene 1, you see this fat sleeping man right in the center of the restaurant. You can see that his belly is exposed, and if you look carefully, there is on his belly is a butterfly shaped tattoo with red borders. But red borders to signify rash. Butterfly, rash should immediately scream SLE, right? And where is this tattoo? On his belly. That should suggest Belimumab for SLE. And also, what else is sitting on his stomach? A giant B. B for B cell activation inhibitor, which is the mechanism of action of Belimumab. Next to him is a kid who was running around. He crashes into the cone and falls, scrapes his knee, and he's bleeding continuously. Kid bleeding continuously should remind you of hemophilia A. Now, if you look at his outfit, he's wearing a Mars print outfit. Mars for Marstacimab. And what did he hit? He hit a cone for Concizumab. So Mars plus cone, Marstacimab, Concizumab, and he's wiping his blood with the tissues that will remind us of anti-tissue factor pathway mechanism. Next scene, we see this healthy food counter. Healthy food means weight loss. So now we're entering into the world of obesity drugs, right? Anti-obesity drugs. So first we see this fat man with tone in the line for symbolizing maximum weight loss. His shirt is split into two pieces and his zipper has also burst open. Tear and zip. Tear, zip, tear, zip. Sounds like terzepatide. And his shirt is splitting into two. That should signifies dual action. That is, it works on GLP-1 and GIP agonist. Next, we see this man with his obviously huge glutes. That's almost like he's asking us to see my glutes. See my glute for semaglutide. And he's holding a snack to symbolize SNAC. That is its mechanism of action. So oral semaglutide uses sodium N-hydroxybenzoyl amino caprylate. Next, we see this famous celebrity. He doesn't want to wait in the line, right? So he's sitting on a stool, a yellow stool. Ori sat on a yellow stool. Ori sat for orlistat, and yellow stool for steatorrhea, which is a side effect. Next, we go to this South Indian dosa counter. Okay, dostat to remind you of all the drugs ending with dostat. So here we see this obviously tired, very pale, anemic looking girl, but look at her bag, it's kidney shaped. So this is chronic kidney disease associated anemia, and all the drugs will be ending with dostat. Here we see this customer doing a dab, so dapro dostat, and she's serving vada, so vada dostat and dapro dostat. Next we see is this tea station, a pro waiter pouring tea pro to map. His eyes are bulging out, and also notice that tie on his neck, a red bow tie for thyroiditis. So thyroid eye disease, teprotumab. Okay, next we go to this tip jar, and you see this small cute little 3-year-old kid putting candies in his tip jar. Candies high sugar should suggest you of diabetes, and he's young, so type 1 diabetes, and tip for teplizumab. Okay, and why a 3-year-old kid? That's an odd number. 3 for CD3 mechanism. Okay, it's anti-CD3 monoclonal antibody. The security lady. Next scene is a security lady. At the entrance is this muscular security lady. Her uniform is covered with crabs. Crabs should remind you of cancer. Which cancer? Breast cancer. And do you notice that mat that says selected people only? That is to remind you of selective estrogen receptor degrader. Also notice the sign that she's touching with her obviously muscular hands. Full restaurant. That is to remind you of all the drugs that end with estrant. So full estrant, and she's blocking the crowd with a lace, so lace estrant. So 2 drugs, full estrant and lacestrant. Next we have is this Halloween grave, a spooky corner. Looks like they have an upcoming event. Grave for myasthenia gravis. Around the grave are roses. Rose to remind you of rosanolixizumab. Okay, and this is your FcRn receptor inhibitor. The rave party poster that says plan a rave party, children below 5 are not allowed. Let's break it down. Plan for zilucoplan, rave for ravulizumab, and children below 5 for CD5 mechanism. That is complement inhibition. That's it. One restaurant, one crazy memory palace, and all the new drugs are impossible to forget. Follow for more.